Hey, I'm Kelby Hightower, Medicare Hub. Did you know that mistakes during the Medicare enrollment process can cost you time, money, and peace of mind? In this video, we'll cover the most common Medicare enrollment mistakes and give you actionable steps to avoid them. Let's dive in. Enrolling in Medicare for the first time can feel like navigating a disastrous maze. There are so many rules, deadlines, and exceptions that it's easy to get overwhelmed. Let's start by understanding the critical enrollment periods and why they matter. So your initial enrollment period, or IEP, is a 7-month window that begins 3 months before your birth date month, and included 3 months after your birth date. For example, if your birth date is in July, your IEP starts in April and it ends in October. Missing this window can result in penalties that stay with you for life. For instance, delaying your Part B enrollment for a full year without qualifying for a special enrollment period means you face a 10% penalty on your premium for every year you delay. That's money out of your pocket every month, potentially for decades. So hear me when I say this. Make sure you're being helped by someone that understands penalties. If you call a carrier directly and speak to a licensed agent in a cubicle, you're risking being told something incorrectly and leaving you paying penalties for years. Another important enrollment period is the General Enrollment Period, or GEP, which runs from January 1st to March 31st every year. If you missed your IEP and you don't qualify for a special enrollment period, this is your chance to sign up for Medicare. However, coverage won't begin until the first of the upcoming month. For example, if you enroll in February, your coverage starts in March the 1st. This delay can impact planned surgeries or treatments, so it's critical to coordinate with your healthcare providers. Additionally, during the GEP, you have the option to enroll in a Medicare Advantage plan, prescription drug plan, or a Medicare supplement plan, which can provide comprehensive coverage options. If you miss your IEP and you don't qualify for a special enrollment period, this is your chance to sign up for Medicare. But be aware, coverage won't begin until the upcoming month on the 1st. Coordinating possible surgeries around your new effective date of Medicare and your chosen Medicare health plans is important. When you have a GEP, remember that the Medicare gives you the ability to enroll into a Medicare Advantage plan or a health plan of your choice. So one of the most common mistakes we see is assuming you're automatically enrolled in Medicare. If you're already receiving Social Security benefits, you'll be automatically enrolled in Part A and Part B. However, if you're not receiving Social Security, you'll need to actively sign up for Medicare. Missing this step can delay your coverage and lead to penalties. Another frequent mistake involves employer insurance. If you're still working and have coverage through your employer, it's important to understand whether that insurance is considered credible by Medicare standards. For example, if your company has fewer than 20 employees, Medicare becomes your primary coverage and you'll need to enroll into Part A and Part B to avoid gaps. Let's take John, for example. John works for a small company with 15 employees. He assumes his employer insurance was sufficient. When he needed surgery, he found out Medicare should have been his primary insurance, leading to unpaid medical bills. By enrolling into Medicare Part B, John could have avoided this situation. On the other hand, if your company has 20 or more employees, your employer insurance remains primary and you can delay enrolling into Part A and Part B without penalties. However, due to new regulations under the Inflation Reduction Act, some employer plans that were previously covered are not considered credible coverage and don't meet Medicare's standard for credible coverage. So for example, some companies have adjusted their prescription coverage or out-of-pocket maximums, which now fall short of Medicare's requirements for credible coverage. This has caused confusion among seniors and highlights the importance of verifying your plan with your HR department. Always request a letter confirming your coverage is credible to ensure you avoid penalties and gaps in coverage. So guys, I want to create a little plug-in here. The importance of understanding when you should enroll. This is so common for people to get confused on. I don't care your education level or your income levels. We've seen people with very low educational entry to very high educational entry get totally confused about when to enroll into Medicare. My encouragement, if you do not have a licensed professional that knows what they're doing, get one like us so we can explain to you your options. understanding that now people are working past the age of 65 because full retirement age at 1960, if you're born 1960 and beyond, is now 67 years of age. So a lot of seniors are working to at least 67 before retiring. And like my mom, she was an RN that worked to 78. She loved her job and didn't have to retire. And some of you guys are choosing to work longer and not take your Social Security until you're 70. But if you have to enroll into Medicare at a certain time frame from 65 to 70 and you do not, you're going to experience penalties, and those penalties are really without just proper guidance. You shouldn't have penalties. If somebody knows what they're doing and giving you educational insight and walking you through the steps and letting you know and then helping guide you towards the enrollment process into Part A and Part B, you should never have penalties. But don't assume you understand, because it's very complicated. Get with a trusted advisor, work with somebody that knows what they're doing, and they can help guide you in the right direction. So skipping Part D prescription drug coverage is another costly mistake. Even if you don't currently take medication, failing to enroll in a Part D plan during your initial enrollment period can result in penalties. This penalty is calculated as a 1% of the national base premium for every month you delay your enrollment, and continues as long as you have Medicare. To avoid this, consider enrolling into a low-cost Part D plan, even if you don't need it right now. So let's address some of the additional questions you may have about Medicare enrollment. For instance, what happens if you're approaching 65 but plan to keep working? If your employer insurance is credible, you can delay Medicare without penalties. However, it's essential to get a letter of credible coverage from your HR department to prove your insurance meets your Medicare standards or credible coverage rules now. Another common concern is how Medicare works if you're retiring and losing employer coverage. In this case, you'll qualify for a special enrollment period, which gives you an 8-month window to sign up for Part A and Part B without penalties. However, the special enrollment period doesn't apply for Part D. So it's crucial to enroll into prescription drug coverage as soon as you lose your employer plan within 62 days. Before we wrap this up, let's review a quick checklist to ensure you're on the right track. So number 1, understand your initial enrollment period. Number 2, verify whether your employer insurance is credible. Number 3, don't skip the Part D coverage, even if you're not taking medication. Number 4, work with a Medicare advisor to simplify the process and avoid penalties. Guys, at Medicare Hub, we specialize in helping seniors navigate the complexity of Medicare enrollment. One of our free Medicare Made Simple webinars, or scheduling a one-to-one consultation with our team. We can guide you through the enrollment process, help you compare plans, ensure you're making the best decisions for your healthcare needs. Guys, I want to thank you for watching. Don't forget to like, to share, to subscribe to our channel. Watch more videos to learn about Medicare enrollment and coverage options. Schedule a call with us today. We want to make your life easy by making Medicare simple.